Hi, I'm Joe Graydon.
I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy, where we bring you the stories behind the health headlines.
This podcast is brought to you by Redix Industries, makers of Utterly Smooth Body Cream. 800-345-7339, on the web at uttercream.com. People love their pets, but can companion animals also help us heal? What are the therapeutic roles for dogs, cats, or even horses? This is the People's Pharmacy with Terry and Joe Graydon.
For hundreds of years, animals have offered comfort for those in distress. They've brought solace to people in hospitals, mental institutions, nursing homes, and prisons. Veterans may find a canine companion invaluable for dealing with PTSD.
Can animal-assisted therapy help ease anxiety, counteract loneliness for the elderly, and calm kids with ADHD? Service animals can help people with disabilities live on their own.
Coming up on the People's Pharmacy, share your story about partnering with a pet to improve health.
First, the news.
In the People's Pharmacy health headlines, blueberries show promise for the brain as well as the heart. Researchers at the University of Cincinnati have recruited 47 older adults with mild cognitive impairment. This makes them highly vulnerable to developing Alzheimer's disease. These subjects were randomized to receive either powdered blueberries equivalent to 1 cup of fresh berries or a look-alike placebo powder. The volunteers consumed the powder every day for 4 months. Cognitive tests showed improvement, and functional magnetic resonance imaging showed increased brain activity for those receiving powdered blueberries. A second trial involved nearly 100 older adults who believed they were losing their mental edge, even though their performance on cognitive tests did not reveal any pathology. These subjects were randomized to receive powdered blueberries, placebo powder, fish oil, or fish oil plus powder. Although there was some improvement, it wasn't as dramatic as that among the individuals with mild cognitive impairment. Prior research with laboratory animals has shown benefit from blueberries for improving memory. Perhaps blueberries could be a delicious way to reduce the risk of dementia.
Another promising approach to Alzheimer's disease prevention shows that aerobic physical activity protects the brain. Nearly 900 people have been participating in the cardiovascular health study for 30 years. These volunteers, with an average age of 78, have undergone cognitive testing periodically. They also answer questionnaires about their physical activity and have had MRI scans of their brains. Those who participated in the most physical activity had larger brain volumes in their frontal, parietal, and temporal lobes, including the memory center called the hippocampus. These individuals were 50% less likely to be diagnosed with Alzheimer's disease during the study. Walking, dancing, swimming, or gardening can all be beneficial. People with mild cognitive impairment also benefited if they increased their physical activity.
Vitamin B12 deficiency can lead to cognitive impairment and dementia, as well as fatigue and nerve damage. A new study shows that one of the most common diabetes medications, metformin, increases the risk of this nutritional deficiency. Over 3,000 adults at high risk for type 2 diabetes were enrolled in the Diabetes Prevention Program. They were randomized to receive metformin or a placebo. Blood was drawn at 5 and 13 years after the start of the study. Average vitamin B12 levels were lower among participants on metformin at the 5-year mark. Similar trends were seen at year 13. People who are taking metformin should have their vitamin B12 levels monitored regularly.
An inexpensive generic diuretic that's often prescribed for patients with heart failure shows antiviral activity against a herpes virus called Epstein-Barr. This virus causes mononucleosis and has been associated with an increased risk of certain cancers. Infections caused by the Epstein-Barr virus are especially problematic for transplant patients or other people with compromised immune systems. Spironolactone apparently blocks the virus from multiplying. It works differently from other antiviral drugs used to treat viruses in the herpes family. The researchers are hopeful that this diuretic might open the door to new treatment options for other herpes viruses that are responsible for shingles, cold sores, and genital herpes.
Stopping smoking is one of the most important things people can do to improve their health. But what's the best approach? Cold turkey or gradual withdrawal? A new study in the Annals of Internal Medicine suggests that giving up cigarettes suddenly may be more effective than the slow approach. The research included almost 700 British adults who smoked and wanted to quit. They were randomly assigned to gradually decrease their smoking 75% over 2 weeks, or to stop abruptly on the first day of the study intervention. At 6 months, 16% of the gradual quitters and 22% of the abrupt quitters were not smoking. Smokers who want to quit may need to try several times. This study suggests that quitting all at once might work best. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon. I'm a medical anthropologist.
And I'm Joe Graydon. I'm a pharmacologist. Many of us love our companion animals, whether they be dogs, cats, horses, or parakeets. They give us love and enrich our lives in so many ways. When we're feeling down, they lift our spirits. Having a pet nearby can help keep blood pressure under control, and studies have shown that people with dogs get more exercise than those without pets.
How else do animals help us heal? Today we're exploring animal-assisted therapy. If you've had an experience with a therapy animal, we'd love to hear about it. Do you have a service animal? Tell us what he or she does for you. The number to call is 888-472-3366.
You can also reach us via Twitter. We're at People's Pharmacy, or on Facebook. In our studio, Dr. Chuck Miller, a Durham veterinarian, is here in the studio, and we'll be talking with him shortly. But first, let's hear now about animal-assisted therapy.
We're talking today with Dr. Holly DeBelko-Shoney. She is an associate professor at the College of Social Work at The Ohio State University. Welcome to the People's Pharmacy, Dr. DeBelko-Shoney.
Thank you.
Dr. DeBelko-Shoney, can you tell us what is AAT, animal-assisted therapy?
Sure. Animal-assisted therapy is really any type of therapy that involves animals as part of treatment. So typically, animal-assisted therapy, some of the goals of engaging with animals ranging from dogs, cats, rabbits, horses, even guinea pigs, is often to improve a patient's social, emotional, cognitive functioning.
Would you please tell us about your research that used horses with people who have Alzheimer's disease?
Sure. We know that animal-assisted therapy, canine therapy in particular, working with dogs, evidence has shown us that has made a real difference in working with older adults with dementia when it comes to reducing their irritability, anxiety, depression. Also, there's evidence that supports engaging with dogs, helps in social engagement and communications with folks with dementia. What we don't know very much about is whether older adults with dementia can engage safely with horses, and could that therapy be beneficial? So my colleagues at the OSU College of Veterinary Medicine and I did a small pilot study where we recruited 16 older adults with dementia, and we randomly assigned them to one of two intervention groups. What we looked at was if there were any changes, two things. One, is it feasible? Can we do this in a safe way? And what we found was, yes, we can. With trained equine specialists with safety reminders with very special horses, therapy horses. These older adults were interested and able to interact with horses. We also found, when looking at impact on mood and behavior, that we saw a reduction in disruptive types of behavior among the participants. It's not unusual for individuals with dementia to engage in things such as wandering, repeated speech, kind of agitation, anxiety. And in looking at those issues, we found that when we compared the folks who were getting services as usual to those who had the equine therapy, there was a significant difference in behavioral issues and challenges as a result of what we suspect is as a result of that equine-assisted therapy. We also found that even prior to going to the farm for the therapy, so these folks were transported on a van out to the farm, even the anticipation seemed to make a difference in behavioral issues. Anecdotally, family caregivers would report things like mom and dad could often not remember what they did during the day or what they had to eat or the activities, but they always remembered the horses. The horses really triggered a lot of reminiscence and other thoughts about their experiences.
Dr. DeBelko-Shoney, what other animals are used in animal-assisted therapy besides horses, which kind of comes as a shock, I'm sure, to many of our listeners?
Yeah. Typically, animal-assisted therapy, dogs are the most frequently used animals, but you also see cats, rabbits, and even guinea pigs.
Yeah, you said guinea pigs. I mean, really? Guinea pigs?
Well, if you think about how guinea pigs can be held, they're soft, there's a lot of tactical kinds of pieces
and
involved.
They're cute.
Dr. DeBelko-Shoney, can you tell us what patients benefit most? You've talked a little bit about older people with dementia. Are there other categories of people and patients who can really benefit from animal-assisted therapy?
Yes, where we have the best evidence is really around young people, at-risk youth, young people with attention deficit disorders, autism. Those folks, we have seen some really promising results around building self-confidence, motivating them to learn and participate, also attention span and concentration, verbal skills. Horses are so sensitive to the reactions and moods of those around them, and they can be wonderful animals to support children who are struggling with some psychosocial issues. Also, children with cerebral palsy, for example, equine therapy has been used to support strength and balance for children who are living with CP.
Dr. DeBelko-Shoney, what is the message you would like our listeners to take away from your research?
Two things, I think. One is to have a deep understanding and appreciation about the power of animals in our life informally with the human-animal bond and how important that can be to our well-being, as well as the potential of using animals to engage and make a difference in the health and wellness of all people. And second, to question some of our own sort of ageist viewpoints or views about individuals living with physical limitations or cognitive limitations, dementia, that I think those individuals can engage in a safe way with horses. We're doing groundwork, so we're not doing any riding per se, but there are a number of older adults who've expressed an interest in riding and, really supporting their choice and autonomy in engaging with horses in a positive way.
Dr. Holly DeBelko-Shoney, thank you very much for talking with us on the People's Pharmacy today.
Thank you.
You've been listening to Dr. Holly DeBelko-Shoney. She's Associate Professor and the John A. Hartford Faculty Scholar in the College of Social Work at The Ohio State University. Her study was published in 2014 in the journal Anthrozoos.
And we'd love to hear from you. Have you had experience with animal-assisted therapy? What about service animals? Give us a call and tell us your story. The number is 888-472-3366. You can reach us via Twitter.
And we are so happy to have here in the studio Dr. Charles Miller. He is a veterinarian who has been in practice for 24 years with Triangle Veterinary Hospital. Prior to receiving his degree in veterinary medicine, he was a respiratory therapist for humans at Duke University Medical Center. And in the interests of disclosure, we need to say Dr. Miller is our veterinarian. Dr. Miller, welcome to the People's Pharmacy.
Well, thanks for having me.
We're delighted you're here in the studio today. We're going to go right to the calls. 888-472-3366 is the number to call. Hugh in Cary, North Carolina. Welcome to the People's Pharmacy. Your story, please.
Hi, Joe and Terry. Yes, my daughter Cody is a member of a local group called Corral, and that particular group takes girls at risk, either they're gang or rape victims or suicidal ideation or anything like that, and they pair them with rescue horses for equine-assisted psychotherapy.
And how well does it work?
It's been working wonderfully. She has started out with individual therapy, and then she's gone from therapy to join the herd, and which is a group kind of set on starting up. And then from there, she's gone into the group, and she's doing very well, and the parents are involved, and it's awesome.
Wonderful.
Thank
Glad to
you
hear about
so
it.
much for your call. We really appreciate it, and we hope others will take advantage of the opportunity as well.
Okay.
Bye-bye.
Great. Bye-bye.
Chuck, horses. I mean, a lot of people think, dogs, sure, cats, maybe even guinea pigs, but horses, they're so big.
They're big and they can be dangerous, but they can also be really powerful and impressive.
And they can. And so when you use horses as therapy animals, they would have to, in therapy, using them as a treatment, they have to be used with a trained therapist. And
Clearly.
So you would always screen the person that you were trying to help before you used them to make sure they were comfortable around a large animal. And they would get some instruction before they used them in the therapy. I own horses. I have horses, and they're very gentle creatures, very very calming just to be around. So,
well, we had the amazing experience of interacting with Dr. Alan Hamilton and his wife Jane's horses. Now, Dr. Hamilton has been a guest on the People's Pharmacy. He wrote a wonderful book called Zen Mind, Zen Horse, Zen Mind, and he is also a neurosurgeon in Tucson.
But they do equine therapy, and they offered us a sample. So we got to experience it, and it was amazing.
We're going to take a short break, but when we come back, we're going to hear about your experiences with animals and how they can help us heal. Tell us about dogs, cats, and other animals that affect your physical and mental health. Share your experience at 888-472-3366. If our lines are full, you can reach us via Twitter or Facebook. Again, that number, 888-472-3366.
You're listening to the People's Pharmacy with Joe and Terry Graydon.
If you like this podcast of the People's Pharmacy and want to continue the conversation, you can join us online at facebook.com/People's Pharmacy to share your thoughts or comments.
Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is made possible in part by Red X Industries, makers of utterly smooth creams and lotions that moisturize deeply to make dry skin feel soft and smooth. The number's 800-345-7339, online at uttercream.com.
If you would like to purchase a CD of this show, you can call 800-732-2334. It's show number 1028. You can also find it at our website, peoplespharmacy.com.
Today we're talking about how animals can help us heal. Our guest in the studio is veterinarian Dr. Chuck Miller, and we'd love to hear from you. Have you had experience with a service animal? How does your pet keep you physically and mentally healthy? Our lines are open at 888-472-3366. You can reach us via Twitter. Again, that number, 888-472-3366.
Mary Pat in Chapel Hill, North Carolina, welcome to the People's Pharmacy. Please tell us about your experience with your therapy dog.
Thank you so much. It's great to be here today. Well, my dog, Jenna, is a rescue dog from the Durham Animal Protection Society, and she is 11 years old. And so we became pet partners in 2011 and began visiting local assisted living facilities with older adults. And she just did so amazingly. It's just remarkable to watch an animal be so intuitive with people that she can interpret whether someone is sad or needing a more energy, and she can do tricks or just lie at their feet. Jenna has just really inspired me of just that medicine comes in so many different forms, not just in those traditional ways that we think of. And recently we've been really excited to start visiting at UNC hospitals in the Hillsborough campus. And Jenna, just the most recent wonderful time that we had there, one of the patients wanted Jenna to come up on the bed with them. And so we put down a clean sheet just to make sure that we keep everything clean. And I lifted Jenna up on the bed, and she just immediately knew what to do. She just lied down next to him, put her nose up near his hand, and he was having trouble getting his hand to move. And Jenna just put her nose right up in his hand and just brightened his day. He just was so excited to see her. And what was really special about this time was this was our second visit with him, and he remembered Jenna. And he immediately said, "Oh, Jenna, I'm so excited to see you." And that is just what makes this so worthwhile, is you know that these patients are hurting in so many ways. And to watch a dog brighten their day and bring healing is just unexplainable. And I'm so thankful for Jenna and to be able to be a part of this with her.
Did you and Jenna have to go through any screening or special training to be able to do this?
We did. So we're part of the Pet Partners program, which is a national organization that you register with. And so you can go to petpartners.org to learn more about it. But what makes it unique is that it's one of the few organizations that hospitals accept for dogs to visit, because you need to renew your skills every 2 years. So both the handler and the dog go through an evaluation process just to make sure that you're up to date on everything. And it's just such a wonderful organization, and we've really enjoyed it.
Mary Pat, thank you so much for talking with us on the People's Pharmacy today.
Thank you so much for having me. I really appreciate it. Hope you have a great day.
Well, what a wonderful story. Dr. Chuck Miller, this doesn't surprise you at all, does it?
Not at all. I've seen this so many times with, in particular, we've already mentioned children, and you see how their faces just light up when they see an animal. But the animals also benefit. You kind of see their faces light up when they see they're being appreciated. So it's a mutual benefit.
Let's go right back to the phones. Kay in Durham, welcome to the People's Pharmacy. What's your story, Kay?
Hi, thanks for having me. I have a service dog named Cruz. He and I have been a team for about 2.5 years. He is a phenomenal animal. He does so many things to help me, and I'd like to tell you a little bit how I got Cruz. I found out about an organization called Canine Companions for Independence, and Cruz lives up to that name, the Canine Companion. He is my best friend, and he helps me be independent in so many ways. Canine Companions, they breed all of their puppies in Santa Rosa, California, and at 2 months of age, the puppies are sent out to people who volunteer to raise the puppies until they're about 18 months old. At that point, they are sent to 6 regional training centers for extensive training so that they can be service dogs. My husband, it took me 4 years to get Cruz. It's a very long application process, and then there was a wait list. So my husband and I went to Orlando, Florida for 2 weeks of intensive training. Cruz knows 40 commands, if you can believe that.
Wow.
That's impressive.
I had to learn those commands. I had to learn how to take care of a service dog. We have to pass ongoing public access tests so that I can take him out in public. And the public access process involves, like, how do you get your service dog in the car, out of the car, through a parking lot, on and off an elevator? How do you get your dog through crowded areas? People step over him on the airplane and he just lies there. It's no big deal. He ignores food that's dropped on the floor in the restaurant. There are just so many skills that he has in a public setting.
Kay, what are some of the commands that you and Cruz have mastered?
Well, I was just getting ready to tell you about that. The 40 commands that he knows, I have adapted those to things that I need him to do. For example, the command tug. He knows what that means. I have a rope on a laundry basket, and when I give the command tug, he tugs that laundry basket through 7 to 8 rooms in our house to get the basket to the laundry room. If I give him the command tug, he tugs my coat sleeve to help me take my coat off. I have a rope on a sliding door in my home that's very hard for me to open. Tug, again, he helps me pull the door open, out we go. Another command we use frequently is the command get. He gets anything I drop, my phone, credit card, keys. Yesterday on the airplane, he even got my book for me. He gets his leash. He gets clothes in the back of the washer and dryer. He retrieves packages left on the front porch. He gets the mail. He retrieves the paper. And I'd like to tell you a little bit about the public access part.
Do, please.
Dog. Cruz goes everywhere I go. Airplanes, any public venue, basketball games, restaurants. He is invisible in a restaurant. He is a 75-pound dog, and he is invisible. He goes under the table. He stays there until I give him the command, up, let's go.
Now, Kay, you have not mentioned a wheelchair, but that's what I'm imagining. Is that the case? Is that how you get around?
Yes, it is. It is.
Now, Kay, I'm guessing that a lot of people want to come up and pet Cruz.
Thank you for saying that. I just had an encounter in a hotel 2 nights ago where 7 people wanted to come up and pet him. And it's very difficult for people to resist petting Cruz because they don't realize the importance of his working mindset. When he has his vest on and he is beside me, he knows he's working. And when people see this beautiful dog with these huge brown eyes and expressive eyebrows, of course they want to pet him. But it throws off his concentration on helping me, and we have to redirect what we are trying to accomplish in a public setting. If people are kind enough to ask if they can pet him before they start petting him, I give Cruz the command to sit, then shake, so a person can have an interaction with Cruz in a positive way so that he remains focused on working and they can shake his paw.
Oh, that's so great. Kay, thank you so much for telling us about your amazing service dog, Cruz. We really appreciate it.
It's a wonderful story, and we really appreciate you sharing today. We are talking about therapy animals today and service animals. We have in our studio Dr. Chuck Miller. He is a veterinarian. He is a wise and wonderful human being and part animal. I mean, it seems like you have an amazing bond with your patients. How did that happen?
Well, the human-animal bond is, as Terry has, said, it's been going on for hundreds, even thousands of years. There was a study actually done in 1984 called the biophilia hypothesis that addresses how animals started being parts of our lives, and it stated that it partly came from signals animals gave to people if animals felt safe, then people felt safe around them. If animals felt threatened, people felt threatened around them. And so they've been a big part of my life since I was a little boy, and I've always loved them. And, there are few universal constants in the world, but one undeniable truth is the human-animal bond, and it's touched me.
Dr. Miller, Kay's story brings up a couple of things that I'd like to talk about just a little bit more. One is the difference between a therapy animal and a service animal. Can we kind of explore that a little?
Yes. Therapy animals are really any animal. I mean, if you have an animal, in essence, you have a therapy animal. You have a bad day at work, you come home and sit on the couch, and your dog gets up there with you and sits on your lap. There's nothing any better. But there aren't any requirements for a therapy animal, and there are no organizations, there are no governing bodies for either animal-assisted therapy or animal-assisted activities. But therapy animals have to be used with a trained therapist, a person that's going to administer therapy and using that animal. Service animals are trained, they have a job, and they perform tasks. Guide dogs for visually impaired people, hearing dogs for hearing impaired people. As Kay Gunner just talked about, Cruz, she uses him for mobility. He opens doors, picks things up, pulls wheelchairs. There's medical alert dogs.
What is a medical alert dog? Because we've kind of heard about this, I think, with people who perhaps have epilepsy or diabetes.
Yes, and those dogs are generally trained to see changes in people's behavior. If you're going to have a seizure, you may act a little differently, but in the pre-ictal phase before you have the seizure. If you're diabetic and your blood sugar gets low or gets high, then you'll see changes in their behavior as well. There are even dogs that have been trained to detect cancer because of odors, lung cancer, bladder cancer, because urine might smell differently, or their patient's breath, or the person's breath may smell differently. There's psychiatric service dogs that help people with post-traumatic stress disorder, anxiety. The way that they may help them is that these people may have nightmares, and so the dog could wake them up if they're having a nightmare. They help them go into places, public places where they may be uncomfortable. So these dogs have a task.
Well, let's go back to the phones. 888-472-3366. Connie, welcome to the People's Pharmacy. Please tell us what you have seen.
Hi, Joe and Terry. I was traveling through the Mumbai, India airport recently, and there were two large dogs, labs or retrievers or something, that were there for people to pet and to be with, to relieve the stress and anxiety of plane travel. And I had never seen that before and thought that was a very interesting and good use of dogs in airports.
Oh, well, thank you for that, Connie. We've never seen that either, although I have seen dogs in airports, especially in Australia. I remember the beagles. They're so cute, and you have no idea that what they're actually doing is looking for drugs in passengers' luggage.
Right. But I love the idea of calming dogs in airports. When I travel, if I'm running late or if the plane has a mechanical problem, it's a very stressful experience. How wonderful. That is such a great idea. Thank you so much for that call, Connie. Let's go to Grapevine, Texas. We have just a couple minutes before the break. Hi, David. Welcome to the People's Pharmacy. What's going on in Dallas today?
Hi, Joe and Terry. Yeah, I thought I'd share another example of animals being used for therapy. Today in Dallas, there's an event called FEAT. It's an Easter egg hunt for the blind. And so these are eggs that are stuffed with little beavers, and they're laid out in a field, and sightless children and their siblings that are also sight-enabled share an Easter egg hunt together. And at the event, they'll have, of course, dogs to assist the sightless. But interestingly, though, they have an organization that has rabbits and small ponies, so much along the lines that the doctor from Ohio State had mentioned, using these types of animals for therapy. They'll be used here today at this particular event. So anyhow, just another example of how that's being applied.
Oh, we sure appreciate that. Thank you, David.
Thanks for the heads up, and hopefully the folks in Dallas will get an opportunity to participate. Bye-bye.
Thank you so much.
We are talking about therapy animals, service animals. We'd love to hear your story. 888-472-3366. You can join the conversation. You can also reach us via Twitter. We're at People's Pharmacy, or on Facebook.
And if you have a question or a story about equine therapy, we're also very interested in that. David mentioned little ponies, and there actually are horses, not ponies, but horses that are about the size of a big dog.
Can you tell us a little bit about those, Chuck?
Yeah, yes, they're miniature horses, and like Terry said, they are about the size of a Great Dane, and they don't realize they're little. They act like big horses, but they're really helpful in animal therapy because they don't impose such a presence, and so people that might be a little less likely to interact with a 1,200-pound horse might be more comfortable interacting around one of them.
Joe, we've got a call about miniature horses. We don't have quite enough time to take it right now, I don't think. So we'll go to it right after our
the break. And the thing that Terry and I were just fascinated when we were in Tucson is this bond that you can form with a horse. There's this almost magical interaction.
The experience that we had, again, doing groundwork, moving with the horse in a ring, not riding, was that we had the opportunity to get the horse to move without using our voices to command it. We had no rope on the horse. So it's kind of a very interesting experience to be able to communicate with a horse just with body language and intention.
And energy. So-called chi. We saw it in action. Well, when we come back, we're going to take more of your calls about your experience with animal-assisted therapy or service animals.
And if you have a story about equine therapy, our lines are open at 888-472-3366.
If you have a question about caring for your service animal, you can ask Dr. Miller. Our lines are open at 888-472-3366.
You're listening to The People's Pharmacy with Joe and Terry Graydon. If you value the health information you get when you listen to The People's Pharmacy, consider subscribing to our email newsletter. You'll get the latest health news and information on upcoming podcasts delivered to your inbox twice a week. Look for the link at peoplespharmacy.com.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is made possible in part by Red X Industries, makers of utterly smooth creams and lotions, helping dry, cracked skin feel utterly soft and smooth. 800-345-7339. The website, uttercream.com.
If you'd like to purchase a CD of this show, you can call 800-732-2334. Today's show is number 1028, or find it online at peoplespharmacy.com.
Today, we're learning about animal-assisted therapies as well as service animals. And the animal-assisted therapy, it depends on what animals you have available. In Thailand, there's an elephant-assisted therapy program for children with Down syndrome.
In our studio, Dr. Chuck Miller of Triangle Veterinary Hospital. He's here to answer your questions and listen to your stories. We go right to the phones. Terry, where are we at?
Well, our number is 888-472-3366. We'd like to talk to Terry is that Appalachian, New York?
Yes, it is. We have miniature horses, and we take them to nursing homes. They pick up on people with special needs. I walk them around Appalachian to socialize them with cars and kids and dogs and stuff. My littlest miniature is named Moses. He's 28 inches tall. I have his brother, Valentino. We call him Tino. He's 31 inches tall. I have a rescue mare, Ellie Mae. She was pregnant when we rescued her. She had baby Grace. And Moses seems to be the most tuned into people. It doesn't have to be a big special need like a person that needs a wheelchair or something. If we're out walking and we meet someone and they have a hurt back, or they have, say they have a person that passed away in their family, Moses will go right up and put his nose, if he can reach it, wherever that person is hurting. When my dad passed away 4 years ago, December 20th, I was practicing loading Tino in our trailer, and they are so smart, and horses don't forget anything. So I was feeling low about my dad. I was practicing with Tino. He puts one hoof up in the trailer, he gets a treat. He puts it down, he puts another hoof up in. He does that repeatedly, so he gets more treats. But when I said, do it for Dad, because I was thinking about my dad, he came right up into the trailer with all 4 feet, and he put his nose in my side and started nuzzling me.
That is such a great story, Terry. Thank you so much for sharing that.
Chuck, the idea of miniature horses doing all these things, I mean, it's pretty astonishing. I think people are going, wow, I didn't know that horses could be so helpful.
And so small.
Yes, they are wonderful. As I said, my wife and I have horses, and they are just delightful. The animals, horses included, they're non-judgmental, and people that may feel bad or have a disfigurement or deformity, depression, just feel more comfortable usually being around them. And so it's not surprising that I hear Terry talk about her hurting and grieving and her little horse picking up on it. They're just amazing.
Let's keep talking about horses for one more call. Jackie in Oakboro, North Carolina, welcome to the People's Pharmacy. Please tell us your story.
Hi, Joe and Terry. I have multiple sclerosis. Excuse me. I have multiple sclerosis, and while I could still walk, I needed an electric wheelchair because I got tired so quick. And I had horses then, and I didn't have enough energy to ride. Well, first I got into a assisted riding program. I had already ridden 40 years, and it helped me, and I just could not get to ride enough. So I found 2 stables whose ladies have been helping me for the past decade, and I needed to use my electric wheelchair a good bit. But after around a year of riding 1 to 3 times a week, I haven't used my wheelchair wore out, and I did not have to replace it.
Oh, what a great story, Jackie. It sounds like the exercise of riding has made you stronger altogether.
I can practice losing my balance on a horse.
Uh-huh.
I can practice losing my balance. The horse's neck is there. I can hold on with my legs.
Uh-huh.
And I can get my muscles to get myself back in balance, along with the muscles being stronger. And I have gone into the stable during an exacerbation, walking like a 90-year-old woman with both my canes really creeping, and get up on a horse, and a half hour later I can walk as fast as a horse, and it's just great.
Oh, Jackie, thank you so much for sharing that with us and our listeners.
Can you imagine that, Chuck? I mean, the idea that somebody with multiple sclerosis could have such a recovery just by riding a horse, even if it's only temporary.
I can, and I've ridden horses, and what Jackie's talking about, losing her balance and having to correct and unexpected, use of muscles. We use that in rehabilitation for, humans and animals when they're rehabilitating from an orthopedic injury, and that doesn't surprise me at all.
We go to Charlottesville, Virginia. Christine, you're on the People's Pharmacy, and I understand that, like Terry, you are a cultural anthropologist.
I so appreciate your show. You do so much for all of us. In 1988, I was in Mexico on a small holiday. I was using Native American cultural models to teach sustainability and gratitude toward the earth. And a woman who had brought back in the 50s or 40s the dogs that were almost extinct then. It's a 60-pound hairless dog. They're only buried in shamans' graves, and they come in two larger sizes, which are believed extinct, although I've seen in Peru and Mexico 2 examples of the 80-pound, and they're absolutely stunning dogs when they've been correctly bred. She was not a show breeder. She was, even though she was an international dog judge, she was a titled woman from Canada who had the money to care, and she gave Frida Kahlo and Diego Rivera their first breed pair. She insisted that I take a dog, and I told her that I wasn't in a position to maintain a dog, but in 2 weeks she made me believe that everything she taught me I could talk to other people about what people did with animals before we became before we saw them as slavery animals, which never happened in the Americas. And they're only buried in graves of shamans, so that's where the residue for study is mostly existent, although there's a lot of naming that gives us clues. And the point of the animal experience for them was that the sacrality of the animal brought them close to something in their hearts, which is, let's say, the wild heart of the planet. At the same time that Mexico and Peru are making dogs sacred and putting them in the hands of shamans, in Japan they're making trees into bonsai and putting them on altars in the house, because at that period in Japan it was becoming less wild. So I think our ancestors recognized that the bond between us and the world of the animal life here is meant to be sacred.
Christine, we really appreciate that.
Thank you so much for this call. You know, you've talked a little bit, Dr. Chuck Miller, about this bond between humans and animals, and you see it every day in your practice because people come in with sick animals, with their cats, with their dogs, with their other pets, and they're hurting along with the dog, and you're there to help heal. And tell us a little bit about that bond, that relationship, and how important it is.
Oh, it's so important, and the veterinarian's role in that, in taking care of the animal. I mean, we look at it as being taking care of both the animal and the owner of the animal, because, as you say, the owner is grieving when their animal is sick, as I have and as you both have, and it's very powerful. It's, as I said before, it's the undeniable truth. There's some things you just can't you can't put into words. There's no scientific reason for it, but you see it, and it's one of the most powerful things that I've ever experienced.
Back to the phones, 888-472-3366. Lou, welcome to the People's Pharmacy. Tell us about therapy dogs, please.
Hi. Earlier in the program, I think Terry said there's no governing body for therapy animals. Just wanted to correct that in that there is a governing body for dogs. It's called Therapy Dogs International, and they're out of New Jersey. We've had several of our dogs certified. What they do is more of a temperament test, making sure that the dog is fit. And then they also offer, if your dog is certified, insurance. So if something would happen, you're covered. Something, the dog was injured, or somebody he fought back, or along those lines. There's insurance that they pay for, but it's a good test. In fact, our labs that are therapy dogs, our one dog would not leave the cheese alone. One of the tests is where they drop food, and because if you're in a nursing home, that happens a lot.
Uh-huh.
They you have to tell the dog to leave it and then, the dog leaves it and goes on. Well, our Bogey likes cheese a lot.
He wouldn't leave it alone.
Yeah.
So did he flunk his test?
I'm sorry?
Did he flunk his test?
Twice.
Okay.
He got it the third time's the charm.
Okay. Well,
Lou, thanks so much for letting us know about this.
I know that our dogs would flunk that test without any question. We go right back to the phones. Charlottesville, Virginia. Hi, Ed. You're on the People's Pharmacy. I understand that you were a child psychiatrist. Is that right?
An adolescent psychiatrist.
Uh-huh.
And I used llamas in therapy.
Llamas? Uh-huh.
And llamas are remarkably sensitive to human feelings and emotions. And they were originally domesticated as pack animals, and so they had to get along with people. And if they are well raised, they can sense when somebody is not feeling well. They were especially good with abused children. They could, children who were afraid of many other things would just hug and hold on to the llamas, and the llamas were very sensitive to their needs. We've had neighbors in the past who would go through a difficult time with loss of family members, and they would come over to visit us, and the llamas would go up to them and just nuzzle them and show them their sensitivity to the mood of the person. So I would just highly recommend that people consider llamas also as a fine therapy animal, and I can testify to how they deal with people who are disturbed and especially young people.
Well, thank you so much for that, Ed. We really appreciate it. I would never have thought of llamas as service animals, but as therapy animals. But why not?
Dr. Miller, we've never had any experience with llamas. What are they like?
Well, I don't have much experience with them either. But they briefly, when I was in veterinary school, I did get to take care of some, and they can be gentle, but they can also be a handful. So I would, if you're going to use them, make sure that you use them with someone who knows how to handle them.
That sounds like a theme for this show. The therapy animal needs to be handled by someone who knows how to handle it, and the therapy needs to be conducted by a therapist who knows what he or she is doing as well.
That is right. And as the previous caller said, that, there actually is no governing body for animal-assisted therapy, but there are each place that you would use the animal has their own regulations. So a hospital may have requirements, or and that would involve using a therapist who is trained with that animal. And insurance, needs to be, something people need to be concerned about. Other things that really hadn't been mentioned that I think is important to point out are, being safe around the animals. Like immunocompromised people need to be careful if you are HIV positive or getting chemotherapy or on high-dose steroids or other immunosuppressive drugs.
That brings up an interesting question because Mary Pat called in earlier, and she talked about how her dog gets up on the bed. And so people are going, what about hygiene? So we know all about the hygiene hypothesis and how kids who are raised at a farm location will have less asthma, for example.
But that's for early in life and normal living.
Right.
It's not the same as a hospital. I understand that therapy dogs visiting a hospital and maybe therapy guinea pigs, if you have them in a hospital, might need baths or something before they start. I don't know.
Yes, and that's true. And if you're going to use an animal like a dog in a hospital, we always put a sheet or a blanket on the bed to help keep them clean. They need to be mindful if people have IVs to not pull their IV out or step on a wound that might hurt them. The animals also need to be, current on all of their vaccines, fecal exams, yearly fecal exams looking for internal parasites, other zoonotic type diseases. And It is important that be done.
But it was interesting. We just talked to someone in the hospital recently, and she said, yes, we do have therapy dogs. And when there's an outbreak, people always think that maybe it's the dog that's responsible. And she said it's always a relief when we learn, not a problem.
It's not actually the therapy dog.
That's right. The dogs aren't responsible. So, Chuck, in summing up, tell us a little bit about how you see this human-animal relationship, whether it's a therapy dog, whether it's just your favorite pet. Why is this so important?
It's hard to put into words. It's just the feeling that you get being close to them, touching them, seeing them interact with you, and it's mutually beneficial. I mean, they feel good being around us as well. So it's kind of a I scratch your back, you scratch my back kind of thing. We're lucky that we live in Western society where animals are parts of our family and not just, a horse to pull a cart or a dog to, chase wild animals away. They live in our house. They live in our bed. So it's
No, they have their own beds.
Okay. Yeah.
In our house, they have.
I anthropomorphize a little bit, and that's okay.
Well, that's all the time we have. Thank you so much for listening to the People's Pharmacy today, and thanks also to Dr. Chuck Miller, a veterinarian with Triangle Veterinary Hospital in Durham, North Carolina.
Lynn Siegel produced today's show. Sophie Copeland provided technical assistance. Al Wadarski is the engineer. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is made possible by Red-X Industries, makers of Utterly Smooth Extra Care 20 Cream with 20% urea for extra skin protection. The number's 800-345-7339. The website is uttercream.com.
And we'd like to offer a special welcome today to our listeners in Erie, Pennsylvania at WQLN.
To order today's show, you can call 800-732-2334. Today's show is number 1028, or find it online at peoplespharmacy.com. When you go to the site, you can tell us what you think about today's show or find information on prescription drugs, herbs, and home remedies.
You could subscribe to the free podcast of our show or to our free email newsletter. It's all there at peoplespharmacy.com. Tell us about your service dog or your therapy animal.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening today. Join us next week when the topic is immunotherapy for treating cancer.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to the People's Pharmacy.